Our bodies are run by this powerful, invisible network of chemical messengers. They pretty much dictate our health from our first breath to our last. We're talking about hormones, of course, and getting a handle on them is absolutely key to navigating some of the biggest health decisions we'll ever make.
And for a lot of us, that journey involves two major crossroads. First, contraception during our reproductive years, and later, managing the transition of menopause. Both are all about hormones, and both bring up a huge question. With so many options and so much conflicting information out there, how do you even begin to make the right choice for you?
So, here's how we're going to break it down. We'll start with the basics, then dive into the CDC's framework for contraception. After that, we'll unpack the really controversial story of hormone therapy for menopause, figure out how to balance the risks and benefits, and finally, bring it all together to focus on how this empowers you.
Okay, let's get started on that lifetime journey, navigating these huge health decisions that pop up from our reproductive years all the way through menopause.
The one thing to really get here is that hormones are the constant thread running through it all. They're like the body's internal internet, these chemical messengers zipping around, regulating everything from our mood to our metabolism. And as we go through life, our relationship with them and the choices we make about them is constantly changing.
All right, let's zoom in on our reproductive years. For millions of people, this means choosing a method of contraception. But you have to wonder, right? How do doctors figure out if these powerful medications are actually safe for a specific person? Well, it turns out the CDC has a really clear guide for that.
We're going to focus on what are called combined hormonal contraceptives, or CHCs for short. You definitely know these as the pill, the patch, or the ring. What they all have in common is that they use a mix of two hormones, estrogen and progestin, to prevent pregnancy.
But here's the thing. They aren't right for everybody. So how does a healthcare provider decide if a CHC is a safe bet for you? Well, they don't just guess. They use this very clear, evidence-based system developed by the Centers for Disease Control and Prevention.
It's called the US Medical Eligibility Criteria, or US MAC. And it basically simplifies a really complex decision. Think of it like a traffic light. Category 1 is a green light. No restrictions, good to go. Category 2 is a yellow light. Proceed with caution. The advantages usually outweigh the risks. Category 3 is an orange light. The risks are probably starting to outweigh the benefits. In Category 4, that's a hard stop, a red light, an unacceptable health risk. And here's how that works in the real world. Let's say you have a family history of breast cancer. That's a Category 1, a green light. But on the flip side, if you have a history of blood clots or have sickle cell disease, that's a Category 4, a total no-go. You can see how this creates a really personalized safety check based on your unique health profile.
Okay, so let's fast forward from one hormonal chapter to the next, menopause. And this is where we run into another huge decision, this one about hormone replacement therapy, or HRT. And wow, this is a therapy with a really complicated and controversial past.
So first off, what is HRT even for? Well, its main job is to relieve what doctors call moderate to severe vasomotor symptoms. That's just the clinical term for the hot flashes, the flushing, and the night sweats that can be so incredibly disruptive when you're going through menopause.
Now, the story of HRT really hinges on one single event. Before 2002, it was prescribed all the time. But then in 2002, this massive study called the Women's Health Initiative, or WHI, came out with results that linked HRT to increased health risks. And just like that, prescriptions plummeted. But here's the twist. We now know that study's findings were misapplied. The women in the trial were on average older and much further past menopause than the women who typically start HRT today. So thankfully, we've moved on to a much more nuanced and personalized understanding.
And don't just take my word for it. Here's a quote directly from the medical literature. A huge problem was, quote, misapplying the results of the WHI trial. The findings were basically generalized to all women, even those who were nothing like the people in the original study. This led to what they call widespread confusion that has honestly lasted for decades, and it meant a lot of women were left to suffer through their symptoms without effective treatment.
So today, the approach is completely different. Back then, it was this one-size-fits-all kind of deal. Higher doses were common, and some people even thought it could prevent chronic diseases. Now, it is the total opposite. It's all about an individualized plan, using the lowest dose that works just for symptom relief. And there's often a preference for things like patches instead of pills, which can help lower some of those risks.
Which brings us right to the heart of the matter for both contraception and menopause. It is all about balancing the risks and benefits, and understanding why your personal health profile is the single most important factor in the whole equation. So, the bottom line is this. There is no universal yes or no for hormonal treatments. It doesn't matter if you're 25 thinking about the pill or 55 thinking about HRT. The decision is always a careful, calculated balance of your own unique health factors and what you want to achieve.
And get this, our understanding of that balance is changing all the time. A very recent study found something pretty incredible. For some women over 65 who were using estrogen-only HRT, there was a 19% reduction in mortality. Now, this is a specific group, women who've had a hysterectomy, but it totally challenges the old blanket idea that HRT is always too risky for older women. It just goes to show, again, how crucial personalization is.
So what exactly goes into that personalized assessment? Well, it's a whole checklist of factors. It's your personal health history, things like migraines or blood clots. It's your family's history of disease. It's any other medical conditions you have, your lifestyle, like whether you smoke, and of course your age and where you are in life.
You can think of the final decision like putting together a puzzle. All these different pieces of your personal health story, your history, your goals, your lifestyle, they all have to fit together to reveal the clearest picture of what's the safest and most effective path for you. And that brings us to our final and most important section, your health, your choice. This is all about taking this knowledge and using it to have a much better, more empowered conversation with your doctor.
Remember, the whole point of this process is not to get a simple yes or no. It's to move beyond that black and white thinking and find the right fit for your body, your health profile, and your life. It's all about nuance and personalization.
And that's really the purpose of this whole explainer. Understanding these frameworks, like the CDC's categories, and knowing the real story behind HRT, these are your tools. They help you ask better questions, and they let you be an active partner in your own healthcare.
So we'll leave you with this thought. Maybe the future of healthcare isn't just about personalized medicine. Maybe it's about a truly personalized conversation between you and your doctor.